Hey y'all, Dr. Maka here, plastic surgeon, Nashville, Tennessee, y'all. And I have two patients having mommy restorations in the form of abdominoplasty or tummy tuck today with muscle repair as well as some liposuction for contouring. Okay, so this question is asking about keloids and scarring, which is an important question. I did promise I'd talk about this. So keloids. So let's first talk about what a keloid is, right? So a keloid represents healing that is basically a little bit over exuberant. So imagine this is your fine line scar, right? What happens with a keloid is it ends up being beyond the boundaries of the original scar. So basically, you have a scar, a line this long, and the keloid ends up much thicker and wider. So a lot of people kind of think they form keloids, but actually they don't. It's a hypertrophic scar. So a hypertrophic scar basically means that scar is thick or raised, right? So you still have your fine line scar, and sorry, not fine line, but you still have that scar, right? But it's raised, right, from the boundaries of the incision. It's not wider. When it's wider and raised, that's a keloid. And actually, I very rarely see keloids. But when I see a patient who maybe they had other surgery and I can see different areas of keloids on their body, something I'll suggest, which actually I've had patients do, is I'll have them have superficial radiation therapy after surgery. And now how that works is it's superficial, which means it doesn't go deep, which means it doesn't increase your risk of malignancies. You have to be careful with radiation, right? Because radiation, especially kind of deeper radiation for the purpose of scarring, you always have to think about the other side effects and other things that are in the area. So how it works with superficial radiation therapy, it actually only affects the skin and maybe some of the dermis, right? And the idea there is to actually decrease or basically drastically reduce the incidence of future keloids. And I've had patients have this for several reasons. I've had tummy tuck patients have it. You basically get it you go the day of surgery, then you go like 2 to 3 days after that to get the treatments. And they haven't had recurrence. I've had patients who actually have keloids, like maybe on the ear or somewhere else. I remove the keloid, then they go and get radiation, and they haven't had recurrences. Um, I've also had patients who've had surgery elsewhere, have formed really thick keloids, and I tell them if we're going to remove this, we have to go all in. And the way to go all in is to remove it, inject some steroid, but also get superficial radiation. You can't have a keloid, cut it out, stitch it up, and expect for different results. Your body has already told you what it's going to do or what it wants to do. So I always think we have to change something up. Now, I'm not saying that this treatment is 100% guaranteed, but in my anecdotal experience, which has been quite a lot, when people get superficial radiation therapy after having a kilo removed, the chance and the incidence is so low of the kilo coming back. So surgery still is an option for you, if you have kilos, we just have to think about the plan and how we're going to